Yes, please start.
Thank you. So, good morning, everyone. We are back with another webinar. Today's topic is cannabis in Ayurveda. So, just before we initiate the presentation for today, I would like to just brief you about our speaker for today. So, Dr. Chitranju Saxena is a certified medical cannabis practitioner with 6 years of teaching experience and 8 years of clinical experience. He studied Bachelor's of Ayurveda, Medicine and Surgery from Garhwal University. He also has a post graduation and PhD in Forensic and Medical Toxicology, and he has completed his medical essentials under Dr. Sahit Tayyar and Dr. Piyush Janeja. He specializes in critical health conditions like cancer, autoimmune diseases, Parkinson's, diabetes, and Alzheimer's diseases. And with this, it's a pleasure to have you on board today, sir. And sir, over to you now.
Raju. Welcome all. I'll like to start with the 50 straightforward, and then if there are any questions, then I'll address all the questions. So, first of all, talking about the cannabis, cannabis is not new to Ayurveda. The Ayurveda people, have been using cannabis from long time back, and there are many of the compositions which I have mentioned in the PPT, and also there are many of the formulations of cannabis present in Ayurveda pharmaceutics, and we have been using this cannabis pharmaceutical for a very long time. So cannabis is not new for Ayurveda, but the problem is there has been mm, uh, there has been a what do you call drift apart of the knowledge of the cannabis with the Ayurvedic physicians, like for due to the ban and all the rules and regulation of on the cannabis, this knowledge of cannabis has been depleted for a couple of years. Now it is coming back to us. So I would like to start with my PPT. Next slide, please. Yeah, this cannabis in Ayurveda is known as Vijaya. So this Vijaya, or it have another synonym with the name Bhang. Bhang is a part of ancient Hindu tradition and the customs in Indian subcontinent. In some parts of rural India, people contribute various medical properties to the cannabis plant. Like for example, what I would like to clarify out here, like when we used to do puja, we are using cannabis leaves. So likewise, in many of the traditions, the use of cannabis leaves have been already mentioned, and we are using it. But here we are talking about the medical cannabis and how to use the medical cannabis for the treatment purpose. We are focusing on that part. Taking the another point, if it is taken in proper quantity, the bhang is believed to cure fever, dysentery, sunstroke, to clear phlegm, aids in digestion, increases appetite, cure speech imperfection and lip sync, and giving alertness to the body. Like it has been mentioned in various places about the cannabis leaf, like it is useful in many of the ailments. Other than this, these mentioned out here, it is also used in many of the other diseases. I'll point out the specific disease and specific use of cannabis. Next slide. Coming to the medicinal properties, as per the Ayurveda, the ras guna viri pak of the cannabis plant has been given. The ras is thick and the gun are lagu and tiksh. The viri is ushna and vipak is katu. So, considering in these points, uh, when we take consideration of virya, that is ushna in nature, so we have to keep in mind कि if we are using cannabis on a very high dose, we have to keep check on the ushna properties of the bhang, and we have to keep check on the pitta dosha of a person. So this is a very important point. Like ushna gun should be taken into consideration before giving cannabis to any patient. Coming to the karmas, like what as per the Ayurveda, what all work does the cannabis do? It does the deepen, pachan, grahi, vajikaran, matkari effect. Explaining to that point means it helps in the digestion. It cures the IBS or the stomach problem. It is also used as aphrodisiac. and it has a effect of madkari, means it produces the dizziness in a person. So in previous time, about the madkari effect, like in previous time when there was no anesthesia, so what Vadi used to do is they used to give a high quantity of cannabis to the patient to perform surgical operation. So it was also used, the madkari effect was also used to do this slight operations, the small procedures on the patient. So the cannabis leaves or the extract was used. Therapeutic use, as per the Ayurveda, is it is used in Agnimandya, Atisar, Grani, Klebbe, and Anidra. I'll explain in later slide what all do these means. So next slide, like coming to the pharmacology. Now I am explaining out here the Ayurvedic pharmacology of this cannabis plant, the bhang or the vijaya plant. Like it has तिक्त रस उष्ण वीर्य लघु तीक्ष्ण गुण and katu vipag. So considering this point, what does it all do? It elevates the kaph and the vat dosh, increases the pith dosh, having deepen pachan ruchya grahi madkari and vavai properties. This will be easily understood by the Ayurvedic doctors. As per the Rasashtra context or the text, the Vijaya has been described as a Upavish in the Upavish Varga, and it directly act on the central nervous system. Acharya Sharandar has also mentioned this drug under Madkari Dravyas. So Madkari Dravyas are those Dravyas which are used when we want the effect of anesthesia on a specific part or in a generalized body. It also increases the Agni, which is the digestive power of a person, and Peth because of the Tikht Ras and Ushna Virya. So previously I have mentioned that Ushna Virya is very important. So what it does is it increases the Pith portion of a person because of the Tikht Ras and Ushna Virya. Next slide. Like coming to the disease point, it has been described for treatment of various diseases, including nidra nash, that is insomnia, atisar, that is dysentery, grahani, that is ibs, mandagni, that is anorexia, uh, kust, that is skin disorders, prame, that means we can take it broadly as diabetes, in unman, that is mental disorders, in Ardhavedak, that is migraine, in Nadi Daurbalya, that is neurological disorders, in Shodh, that is generalized or localized swelling, in the as a Dhatu Stambhak, means it also increases the episodic effect within a person. Besides this wide range of therapeutic utilities, the highest number of formulation is advised in Grahani, followed by Jwar, Atisar, Agnimandya, and Prame. So, as per the Ayurvedic classical text, the formulations are basically in which they have used the cannabis are prescribed basically for Grahani, that is digestive disorders, for Jwar, that is pyrexia, that and for Atisar, that is again gastritis disorder, gastric disorders, Agnimandi, that is again gastric disorders, and Prame, that is diabetes. So the Acharyas has used it basically for digestive disorders in the formulations they have prescribed. So other than this, it also helps in central nervous system disorder, in the neurological disorder, in insomnia, many of the things. Next slide. Brief description about cannabis based Ayurvedic formulation. Like coming to the formulation, the bhang is used in 193 classical formulation, out of which 102 formulations contain bhang as a major ingredient, whereas 91 formulation contain it in minor ingredient form. These formulations are mentioned in 67 Ayurvedic classical texts. So, as I was saying, bhang or the vijaya or the cannabis is not new to Ayurveda. There are many of the knowledge available, but it is scattered within 67 volumes or the 67 different types of Ayurveda books. So every acharya has known the use of cannabis. They know how to use the cannabis and where to use the cannabis. This knowledge is not new for Ayurveda persons, but because of the gap, because of the restrictions of over the cannabis by the law-making authorities, this knowledge has been depleted. Now it is slowly and gradually coming back to us. Next slide. Now here I'll present some of the cases because we have a very less time. So I'll present some of the few cases where you can use Vijaya extract or any of the formulations of cannabis. And it other than this, many areas which I have not mentioned, but I have used cannabis in many of the other areas. Like coming to the case study, there was a female patient having severe cramp during menstrual cycle. So she came to me and asked me, I want something to treat my pain. So I said, okay, we can start with Vijaya stack with the name of Woven Wellness. It is external like. So approximately 5 drops. It can externally, she can externally put it on the lower abdomen, and when the pain start until the pain stop means what I suggested her ki, whenever the pain start you apply it, wait for half an hour, and if the pain reduces, okay, if not reduces, again use it. So when I told her, what she did is she applied the external application, and after 5 to 10 minutes the pain subsided to that much level she was able to easily bear it. So what I got in as an outcome was there was significant reduction in pain, and then I use other Ayurvedic modalities to cure the cust artha of the patient, and I got a very good and wonderful result. Now she is having a normal menstrual cycle without pain or very less pain. For last 5 to 6 cycles, she didn't have any pain while having menstrual cycle. Next slide. Now here we will discuss about patient of lower back ache. Like 54-year lady was presented before me, was having a history of 3 years lower back ache pain. So what I did was I gave her a tincture with the name of Pain Aid, 7 drops BD. That was eventually raised by the slowly and gradually I increases the dose, and on the 7 drop BD dose I got the result. Like when I started, she came to me. I started with a single drop, and slowly and eventually I goes up with the dose. And on 7th drop, I got a desired result that she was ease in pain. And I also use other medicines like Triphala, Google, and etc. in the Ayurveda, and external application was also given of the oil, the Ayurveda oil, and there was ease in the pain. So what I got in after 2 weeks, the pain was so much manageable like that. She was able to do her daily routine work easily. Okay, so what I came to, what I got from this, that this cannabis on internal administration along with the Ayurveda medicine gave me a very good result. Previously, I was not able to reach these results very quickly, but now with the help of cannabis, I can reach a certain point of good result with very less amount of time. So my treatment duration was reduced, and I reached a very targeted result within 2 weeks. So this cannabis helped me for the pain purpose also. Next slide, ma'am. Like this is a very interesting case of premature ejaculation. Like 36-year male patient was having this problem for last 1 year. So he was presented before me. Then I classically used the Ayurveda formulation for him. I was not able to get the desired result, and patient again and again after 3 months of under my treatment was again and again complaining about premature ejaculation. So what I did was I used cannabis with this patient. I gave a capsule with the name Pain Aid because it have 150 mg of cannabinoids in it. I used it twice with after food with milk fat, that is malai. So what I prescribe to the patient, like you just take the capsule and with water and take a teaspoon of milk fat after that, and you contact me after 15 to 20 days. So after 15 days, he contacted me, and there was no complaint about premature ejaculation. He was extremely happy with the treatment. I continued that treatment for 45 days. Until now, he is having no complaint about it. The treatment went along for whole 45 days, and I also noticed was that there was increase in total sperm count of the patient. So I received a very good verdict with this. Yeah, other Ayurveda medicine, other aphrodisiac medicines were also included with this prescription. But previously and after using the cannabis, the difference is previously I was not getting a very targeted result with while using the Ayurveda medicine. When I used cannabis along with the Ayurveda medicine, I got a very good result. So, cannabis this gave me a very good result on premature ejaculation also. Next slide. Like coming to the next case slide, this is a very one of my oldest case study I used to always mention in every of my webinars. This is a case of cancer-induced nausea vomiting. Like 42 years female patient was diagnosed with breast cancer and was treating with chemotherapy. So what happened was during chemotherapy she was having episodes of nausea and vomiting. So what I did was I gave her the extract of cannabis 5000 mg, 2 drops in the morning, 6 drops in the evening after food with water. What I used to do is I asked the patient to take 2 drops in a mouth, keep it for 5 to 10 seconds, and then drink a sip of water until she is at ease, because it is very pungent in nature. So the patient was easy to gulp it for starting days. Now she can take it regularly without the help of water. So I only use cannabis out here. No other medication was given. Only the modern medication with the prescribed by the modern oncologist was given. I only use the Vijayastack Canoral 5000 mg, 2 drop in the morning, 6 drop in the evening, and the outcome was the outcome I got it on the next day itself. But I waited for 15 days, and after 15 days, the patient was very happy with the treatment. There was decrease in rate of nausea and vomiting episode. She was for the next 5 cycles. She continued this treatment, and she was not having this nausea and vomiting episode. There was some pain and in the leg, so that also reduces. Other symptoms like pain at the back and in the chest also reduces, and it help a lot with the patient. And the chemotherapy did its work against the cancer cell, and I just give Vijaya extract for combating nausea and vomiting. And presently, the patient is cancer free because of the chemotherapy, and still taking the cannabis extract for as a maintenance dose, so that cancer do not comes back. And it's a belief of a patient कि if I continue taking cannabis, the cancer will not come back to me. So I said, okay, you can take the maintenance dose, and if you wish to take, and you can continue it. So I'm continuing the dose. I have lowered the dose to the half drop in the morning and half drop in the evening. Now patient is happy and it is continuing it. So this cannabis helps a lot in cancer-induced nausea, vomiting. And the next case, yeah, coming to the point, cannabis, the conditions in which cannabis can be used. Like I was explaining previously in the webinar that I have used cannabis in many of the cases. I'm presenting a very few, like what all cases I have used in the gastroenterologist and gastroenterologist. andrological cases, like which where I have used is in intestinal spas, insecurity, diarrhea. And in the cases of jaundice, I got a single case of jaundice, and he was given modern treatment for jaundice. So what I did was I used some of the herbal medication from Ayurveda side along with the cannabis, and then gave it to the patient, and the patient got a very good result and was free from jaundice. In the gynecological cases like dysmenorrhea or the lower urinary tract symptom, for the lower urinary tract symptom, my mother suffers from diabetes, and she was frequently having lower urinary tract symptoms. Like she was frequently having the LRTI infections. So what I did was I got a consultation from the gynec for her LRTI, and I started cannabis. So what happened was slowly and gradually this episode reduces, and now she is fine because cannabis helps in both the things, in the lower urinary tract symptoms, also in the cases of diabetes. So she was having diabetes, the cannabis helped in diabetes along with the lower urinary tract symptom, so it helped her in the both the ways. In the sexual cases, I have discussed the case of premature ejaculation. In the infectious disease like anti, it act as a antibiotics and anti-malarial diseases. Like my one of my patient was suffering from malaria, and she was not able to respond well to the medicines, to the modern medicine. Then they contacted me to, doctor, what you can add. I gave them some of the medicines from Ayurveda along with cannabis, and it helped a lot to my patient. So next slide. Yeah, therapeutic properties of Vijaya. This is very important. Everybody should know. Like Vijaya directly influence our body's endocannabinoid system, enable the herbs to elevate various health issues such as in the cases of pain, it helps a lot. In the cases of inflammation, it helps a lot. In digestive issues like IBS, IBD, diarrhea, constipation, etc., it helps a lot. In the mental health issue like PTSD, social anxiety, depression, mood fluctuation problem, like it helps a lot. It helps I have treated many of the patients with PTSD and mood disorders, and this cannabis works very nicely in them, and it had helped many of my patients for this mood disorders. Menstrual problem in the cases of period pain or the cramps, dysmenorrhea, PCOS, it helped a lot. I got a very unusual result when one of my patients that she was suffering from a problem known as PCOS, and what happened was she was having consultation with me for anxiety, and she didn't told me that she was suffering from a disease known as PCOS. What I did was gave her this I gave her this cannabis, and it helped a lot to her. And then again, it helps in sexual health problem like erectile dysfunction, premature ejaculation, in the cases of infertility, low sex drive. So it's helped a lot in this sexual disorders also. Next slide, ma'am. Other conditions which can be included are like other condition which are included are like Alzheimer's, in the cases of Parkinson's, in the cases of cancer, in the cases of glaucoma, osteoporosis, arthritis, autism, seizures, fatigue, obesity, hepatitis, multiple sclerosis, epilepsy, alcoholism, drug addiction, insomnia. I have read so many of the papers published in within India and outside India. They are using cannabis in on all these cases, and they are getting good results. So, I got a very good result with a patient of Parkinson's using cannabis. specifically the CBD-rich cannabis. In the cases of arthritis, the pain in the knee got reduced. In the cases of seizures, it worked wonderfully. In the cases of epilepsy, it helps a lot with the patients suffering from epilepsy. So, cannabis is a wonderful medicine which helps in many of the areas, but you should know how it helps and how it works within the body. You can able to use that cannabis in many of the places. Uh, since Ayurvedic medicines derived from Vijaya contain natural ingredients, they are easily tolerable and safe for consumption. The word I have written safe for consumption is because till now, up to my knowledge, I haven't read any of the cases where the patient got disease because of the use or the overdosing of the cannabis. I have not read up till now. There might be a case, but I am not aware of any of the such case. So, but if you take it and with proper consultation and with the proper doctor who have a training on this cannabis and been using this cannabis for a longer period of time, so this medicine is very safe and very easy to use, and it is easily tolerable, and it is very safe to use. But the thing is, one condition applies: the person prescribing you the cannabis should know how cannabis work and how does it can produce ill effects on the body. Then only he can be able to judge how much to give and when to give. So this is a very important point. Everybody should know about that. Next slide, ma'am. Thanks. From my side, if there are any question, I'll be most thankful to answer that.
Um, Thank you, Dr. Chitranshu. I think we have questions coming in. So, is any role of cannabis in post herpes and zoster neuropathy?
Yeah, it helps in reducing the pain because I told you कि in herpes there are pain involved. So cannabis can help in this pain section of this herpes, and other thing can be managed with the antiviral and the other medicines for the herpes that are prescribed. But for pain, you can use cannabis.
So, cannabis used in cancer treatment, will it help cure the tumor?
Um, Up till now, there are no documentation available that I haven't seen. There are मतलब कि definite results are not up till now, but yeah, there are studies which say cannabis helps in curing the cancer of a specific type in a specific condition. Yeah, cannabis can definitely be helpful in curing the cancer, but there are not definitive result up till now. Hopefully, in future, many of the scientists can do research and give definitive result. But up till now, for cancer itself, we can say it help as a very good palliative care. So, palliative care will help you a lot in managing the chemotherapy and the radiotherapy side of the cancer treatment. So what you can do is you can use cancers along with chemotherapy and radio. You can use cannabis along with chemotherapy and radiotherapy in cancer patient. It will give you a very good result. What will it do? It will increase the threshold of the patient to easily take this chemotherapy and easily handle this radiotherapy. It will increase the threshold of the patient.
Sir, can we connect with Dr. Chitranshu for further details? Yes, sir. So as you can see, I have displayed the contact details on the presentation right now. You can see it over the screen. I have also shared the details of Cannazo India. If anyone wants to connect with us and wants to work ahead with these medications, we have a wide range of products, including for the problems which Sir has mentioned. And just a piece of information that the website might not be available for 1 2 days since we have changed the domain. to a new platform for better user friendly experience. So another question which is coming in is, Vijay, in which form?
Vijaya can be used in many of the forms, like you can use the Vijaya leaves, dry leaf powder. You can use it in liquid form. You can take it in liquid extract form that our companies are providing. And you can get the swaras or the juice part from the fresh leaf itself. You can use it in any form, but the thing is that the main point that arises is how much to use and when to use. That is a matter of training. You will get that information from a very trained person. He will help you out when to use, what to use, and how to use. That is a very important thing.
True, sir. And on this, actually, I would like to add that in association with Cannazo India, we will be providing continued medical education in the upcoming days. So, if any doctor is interested in, attending the course, it is not a certification course, but yes, it will tell you about the dosing or how and which mechanism and which therapeutic use it can be used for. So, if any doctor is interested, they can note down my number, Arzu Puri, and they can contact me for the same. I'll be sharing a Google form with them. So, the question is, so how to give cannabis in which forms? I think so has already answered this question that we can give it in tincture forms or we can give it in capsule or raw powder form. So do we have any other questions? Drop space both are available. Yes. I think so we have covered all the questions for today.
Okay, as you have already mentioned about the course, like the doctors, it is specifically for the doctors fraternity, that if you want to know more about the cannabis, there is a course going on about the cannabis. What you can do is you can contact Arzu for that, or you can call me directly, and I'll give you all the details of the cannabis course. You can get associated with us. And Dr. Sayyid Tahir is conducting a course, this certificate course, and you can get all the detailed knowledge about cannabis use, how to use, when to use, and where to use.
Yes, it's a proper 2 year course, and we also have a short term course going on. So you can just contact Sir or me regarding the same. And so, just before we finish the session, just one question that what's your take on the contraindications or the side effect part?
Like side effect part is just well, there is a shloka in Ayurveda. I would like to state it. The shloka goes like Yogada api visham tikshanam bhaishajam bhavet bhaishajam cha duryuktam sa sampadati. That means if you use something within a limited quantity or the permissible quantity, it will act as Amrit. And if you use something in proper dose, it will act as a Visha. It also means whenever you use Vish in a proper therapeutic quantity, it will act as Amrit. And if you use Amrit or the other medicines in improper quantity, it will act as a Vish. So about the contraindication is just one thing to take is the dosing is very important. You have to be very careful about the dosing, and whom to give, it's very important. Like cannabis is not a medicine to be given to everybody. It should be given on a specific condition and a person to the person who actually need cannabis. It doesn't mean that you have to give cannabis to everybody. There are many of the cases in which we don't have to use cannabis. There are many of the cases where we have to use cannabis with a caution, and in some of the cases we can freely use the cannabis. So after getting a proper knowledge on this cannabis only, we can use this cannabis. And about the dosing is very important. There is only one principle about the dosing is give low and go slow. Give the lower dose and go slow on the dose. That is a very important and key point of giving the cannabis medication. So that should be kept in mind. And if you have any of the problem with regarding the dosing or anything, you can contact me on my phone number.
So one more question we have is any role in sciatica pain?
Yeah, it is a pain and it will help me in pain. I am saying that This cannabis help in pain, any type of pain. It will help out. In sciatica patient, the lower back patient was suffering from sciatica only, which I have already explained in the case study.
Okay, sir. I think that was the last question we had. We have covered all the questions. So, sir, I would just like to thank you. Thank you for such an informative session. I think it's very important that people know that how Vijaya is being used in India and how it's being accepted amongst the doctors. And if there are any more doubts, any doctor can contact us. Thank you, sir.
Thank you, ma'am. Thank you, sir.
Thank you. Thank you. Bye.
Bye, sir.